I am Liz Powell. I am the founder and head of G2G Consulting. And my job is to just kick things off and then turn it over to the experts. So before we get started, I want to say good morning, good afternoon, no matter where you are. I know for some today is a very challenging day, the anniversary of 9/11. So just wanted to acknowledge that. And I actually was working on the Hill that day, so I'll never forget that day. So for those who are feeling sad today, I just want you to know you're not alone. We want to focus on ways to help nonprofits today be successful and advocating for really important causes, for getting funded, either directly to the nonprofit or at programmatic levels within agencies. We're hoping that we'll be able to answer all your questions in these areas. And if we don't, we want to hear from you. So please email us if we could answer a question for you, or if you'd like to set up a time with us. We are here to be helpful. So we're going to talk about the legislative process, executive process, advocacy, insights and tips, and then key takeaways. And most of all, we're going to hear from two national leaders running nonprofits in advocacy who have amazing stories and tips to share. So I'm super excited about the panel that we have set for you today. Next slide, please. So some background. So G2G, which stands for Government to Growth. As I said, I started in 2007. After working on Capitol Hill, I staffed a couple interesting committees and the Women's Caucus, the Disabilities Caucus, military, health and social service, a lot of different areas. I'm also an attorney with an MPH and have always been very passionate about working with nonprofits to help navigate government. And I started G2G because I met a lot of leaders who were doing great things, advancing really important causes from health to education to criminal justice, all kinds of issues, but not necessarily knowing how to access funding, how to shape the process, how to build relationships, lead advocacy campaigns. And that's where I got the idea for G2G, Government to Growth. And so over the years, we've worked with many organizations, both the for-profit and non-for-profit side. We do a lot of work in the Midwest as well as in Washington, D.C. We're sort of spread out across the country. We've raised $531 million in government funding for the organizations and companies we work with. We've led tons of advocacy campaigns, Capitol Hill fly-ins, congressional briefings, receptions, media outreach tied to all these events, crafted legislation, worked on messaging, strategies to really direct funding and change policies and regulations and have an impact. And those relationships have been key long-term because people move around within agencies, staff move around in congressional offices. So having those relationships over the long run are super, super helpful. And most of all, we've made a difference. And, you know, one example, we worked with an organization, a nonprofit dedicated to rare cancers, 380 rare cancers out of 400 total rare cancers. Most people don't realize that. And most of the government funding was going towards the common cancers. And we don't want anyone to suffer from cancer, so it's all important. But we need more funding and dedication to rare cancers. So we did a whole advocacy campaign. We met with all the members of the Appropriations Committee. We inserted new funding lines. We got new programs ranging from the FDA Oncology Center of Excellence, created a whole new rare cancer initiative with $5 million there. We created a new research funding line within the defense bill under the congressionally directed military research program. Again, never before had they had a rare cancer line. We got 5 million, 10 million, 17 million, and then it kept building over time. Now it's well over 50 million since we started that program. So I point that out as an example of making a difference. You can make a difference, and you're not going to do it with the snap of your fingers, but you can do it over time. If you put in the months, the year, couple years, you can really make a difference. And so I hope that's the biggest takeaway from today, that your voice matters and you can make a difference. Next slide, please. Okay, so here's some examples of the nonprofits we've worked with. We actually have way more. There's too many to put all on one slide. So we sort of picked out a diversity of folks. So everything from America View, which is on remote sensing and all the satellite imagery that we use on our phones every day. There's actually professors and brilliant people behind that help translate that and ensure that we're building the pipeline in our youth to take over these jobs, because these jobs are really the future of our country. They're now and the future. So it spans from that to epilepsies, to women's health, to community development and investment, to the biosciences, to senior living. The Shepherd example is down there, Pregnant with Possibilities, museums, like, so all kinds of nonprofit organizations can get engaged in government and make a difference. You can advance causes, you can access funding, you can build relationships, you can drive change. So that's the point of this slide. And I think I am done and passing it over to my esteemed colleague, Chris Cooper.
Thanks, Liz. Hello, everyone. My name is Chris Cooper, and I am a Government Affairs Director in G2G's Washington, D.C. office. Just to share a bit of background about myself, I spent over a decade on Capitol Hill, working with two leaders on the House Appropriations Committee. I wore many hats during my time in the House, but most importantly for this discussion, I spent years leading the legislative team, drafting bills, advising the congressman on policy, and meeting with advocacy groups and other constituencies. So over the next few minutes, I will highlight some key ways you can influence the federal legislative process and also access federal funding. Next slide, please. So to kick things off, I think it will be helpful just to set the stage and explain what the difference is between authorization and appropriation. So Congress exercises its power of the purse by authorizing and appropriating federal spending for activities that impact our daily lives. This is typically a two-step process managed through a division of labor within the committee system. So for example, legislation may be introduced to modify a Department of Justice program to allow grants to be used for training first responders on the use of containment devices to prevent secondary exposure to potentially lethal substances. So that would be an authorization bill because you're authorizing the Department of Justice to allow grants to be used for a very particular purpose, but you're not also directing funding in that legislation for that purpose. So once that legislation is signed into law, the Department of Justice may still need additional appropriations or funding, in other words, to carry out the new activity. Next slide, please. Most of the bills that are introduced in Congress are what we call or refer to as authorization bills. And the simplest way to think about these is these bills aim to create, continue, or modify an agency, program, or activity. Authorizing legislation also gives the green light, either directly or indirectly, for funding or appropriations for an agency or a particular program. Just as another example, a senator might introduce a bill to create a new environmental program under the EPA. And the bill text could specifically authorize $30 million for the program over 5 years. So again, they're attaching a certain amount of money to be authorized for the program over a specific time frame, but they're not actually appropriating the funds within that legislation. Key parts of the authorization process to keep in mind include building support from stakeholders, which can be expressed in letters, phone calls, Hill visits, many different ways. Ideally, you want support or backing from both Republicans and Democrats in both chambers of Congress, especially in a situation like we find ourselves right now, where there's divided government, where Republicans currently control the House and Democrats currently control the Senate. And then finally, there's an ongoing process that's necessary to help push the measure through the committee process. So we'll cover that a little bit too. Next slide, please. Before we jump into appropriations, I think it's important to highlight at a high level, the spending caps in place and how both chambers, the House and Senate, are handling these caps for fiscal year 2025, which is the fiscal year that Congress is currently working on. So last summer, legislation called the Fiscal Responsibility Act was signed into law, setting limits on federal discretionary spending for both fiscal years 2024 and 2025. The legislation established caps for both security and non-security programs. So for both national defense related activities that the government conducts, as well as non-security related matters such as environmental protection activities, healthcare programming, things of that nature. And as you can see at the bottom of the slide, while both chambers are looking to increase defense spending for FY25, there's a pretty significant difference in how they're approaching non-defense spending, like funding for health, housing, agriculture, and other programs, other domestic programs. So that gap that you're seeing there, the House's proposal to reduce by 6% non-defense spending from the current fiscal year, and the Senate's proposal to increase by almost 3% that non-defense spending, that major gap is a reason why we don't expect Congress to pass an appropriations package before this fiscal year ends on September 30th. Next slide, please. The appropriations process, as opposed to authorization process, which we just covered, is how Congress allocates funding to different federal departments, agencies, and programs. And that happens on a somewhat regular cycle that I will walk through on the next slide. But just at a high level for you to know, there are 12 appropriations subcommittees represented by the graphic on the right that set the funding levels for these entities. And as you can see by the pie chart on screen, the Department of Defense has, by a pretty significant margin, the largest budget. These committees also produce reports that go along with the appropriations bills, and these reports provide directions and additional details on how Congress expects the money to be spent by the departments and agencies. So it gives a little bit more clarity to Congress's intent with the funding provided beyond simply stating a certain amount of funding being appropriated for a particular federal program. And federal agencies pay close attention to directive language, so it can be a great way for nonprofits to engage both Congress and the executive branch with a single action. Next slide, please. You might be wondering, where are we in the appropriations process currently, and what are the usual milestones in that process? So between September and December, the Office of Management and Budget, the White House, and various federal agencies are usually busy crafting or working on next year's budget proposal. Then between January and April, technically, the president is supposed to submit his budget request to Congress in February, but sometimes that can bleed into March or April. So between January and April, the president sends the budget proposal to Congress. During this time frame, the House and Senate Appropriations Committees also hold budget hearings and set deadlines for bill and report language requests, funding requests, and what we call community project funding or congressionally directed spending requests. You probably have heard the term earmarks before. CPF and CDS requests are just another way to refer to earmarks. From May through July, the appropriations committees keep the ball rolling by conducting more budget hearings and voting on the 12 appropriations bills so that they can be sent to the chamber floor for further consideration and further action. In August every year, Congress takes a recess, which basically means senators and members of Congress head back to their home states or districts. And, this is a great time for outside entities to invite their senator or their representative to see firsthand the incredible work that you might be doing in the state or district, because they are routinely during the month of August going to roundtables, conducting site visits, and doing a lot of those other activities that they can't really focus on while they're in Washington voting at other times of the year. Before the new fiscal year starts in October, Congress usually needs to pass what's known as a continuing resolution or a CR, just to keep current funding levels in place and to keep the government open and give Congress more time to negotiate a new final funding package for the year. And then sometime between October and December, though it can stretch as late as March of the next year, Congress will pass an omnibus spending package. Omnibus just meaning that they're catching all 12 of the appropriations bills that they need to pass to keep various departments of the federal government operating. And one thing that I want to point out too is congressional leadership will often attach or tack on other time-sensitive must-pass legislation to this omnibus bill because it is seen as one of the only must-do every year pieces of legislation. So, for example, we could be looking at a situation as we head toward the end of the year this year where congressional leadership will attach what's called the National Defense Authorization Act to that omnibus package. Next slide, please. There are several ways that you can influence and shape the appropriations process. Put simply, I'll just cover three options: programmatic funding requests, directive language, and earmark funding. So if you want to show general support for a department, an agency, or a program, or if you have a specific funding level in mind for them, so say you have a specific funding level in mind for the National Institutes of Health in the Department of Health and Human Services, you can consider going the route of programmatic funding requests to simply request a funding amount for that agency. Another option is to push for directive language, which I mentioned earlier, in the committee report, which helps guide the department or agency to take certain actions. And then lastly, you can pursue an earmark, which involves securing a specific amount of funding for a very particular purpose or project. And unlike general funding, earmarks are targeted and don't require competing with others for agency resources. So the recipient of earmark funds are listed in those appropriations committee reports that I mentioned earlier. One important thing to keep in mind on the earmark front is that for-profit entities are not eligible for earmarks. This funding is particularly reserved for state and local governments and nonprofits. Next slide, please. So as I mentioned earlier, just now, for-profit entities aren't eligible for earmarks. This funding is specifically for nonprofit entities, colleges and universities, and government units. Often you'll need matching funds, and the money can be used for things like programming, equipment, or construction. While there are exceptions, most requests fall between the $50,000 and $5 million level, depending on the scope of your project and the appropriations bill and account the funding would flow through. If you're thinking about pursuing an earmark, there are a few key things to keep in mind. You want to make sure that you have strong evidence of community support through letters of support. Those letters can come from mayors, city council members, other community leaders, or local, key local voices. Another thing you'll want to think about is how your project potentially aligns with the priorities of the member or senator you're approaching to support your project. So if you notice that your member of Congress has spoken a lot about how roads in the district are deteriorating and you have a roadway project, that is a nice little alignment with something that member of Congress has expressed as a key priority and something that they're thinking about a lot. Doing these things can really make a difference and set you up for success when you're going through this process. So the other thing I would point out is if going the earmark route sounds interesting to you at all, it is a good idea to start your research now for the fiscal year 2026 cycle, which is approaching quickly. You'll want to have everything in order early next year so you can meet the deadlines for submitting materials to the congressional office, which is usually between February and April. That's all I have for now. So I'll hand the mic to my colleague, Katie Collins, who will cover opportunities to engage the White House and federal departments. Thank you.
Thanks, Chris. Hello, everyone. My name is Katie Collins. I am a vice president here at G2G and handle our federal affairs work. It's a pleasure to be with you this afternoon. Let's see, before joining Liz, spent over a dozen years in Washington, D.C. Very early in my career, spent some time working for the Department of Defense. Later spent 6 years in the Obama-Biden White House, where I was the policy staffer on the original iteration of the cancer moonshot, and then was the program director at the Biden Cancer Initiative before doing some legislative advocacy work for the National Institutes of Health. So we're going to talk a little bit today. Chris did a great job discussing how we can affect legislative change through working with Congress. And so we're going to speak about how the White House and agencies affect that process and what advocacy with those groups looks like. So first of all, we'll start with the White House. So working with the White House and bringing your issue to the administration can really have wide-ranging impact, despite the fact that the president and his team do not make the laws. So I think speaking from my own experience, the cancer moonshot is a great example of how we saw a presidential or a vice presidential priority really have a ripple effect through the rest of the government, both in terms of funding available for that issue, but as well as the regulatory side. You know, they created an FDA Oncology Center of Excellence just to move cancer innovations through the pipeline, new CMS regulations, expanding access to care for those oncology innovations. So we really see an effect throughout government when the White House takes a stand on an issue. We've seen this recently with women's health. 2024 has really been the year of women's health, and a lot of that was catalyzed by the new White House initiative on women's health research, which brought new funding to the area. It brought kind of a renewed passion for people outside government to see this focus. And it honed all of the agencies in on women's health research because they're held accountable by the president to achieve a goal. So engaging with the White House and getting them to care can be very, very important. It can also influence the president's budget. We know the president does not have fiscal authority, but at the same time, he releases a budget each year that reflects his or her priorities and does impact how Congress then delegates funds. And rulemaking, executive orders can have a lot of power. We've seen a shift towards more executive order power over the past decade or so. So how do we engage with the White House? What does that look like? You need stakeholder support, just like Chris talked about with Congress. You want to be working to influence that presidential budget. So meeting with the correct policy person or team in the White House or the Office of Management and Budget. Talked a little bit about executive orders, educating the right people to care. That comes through public awareness and can also come through engaging with social media or even the media directly. So the White House does have then authority over the federal agencies and departments, and you see the White House's priorities reflected through agencies. So when you're going to work with a federal agency that's close to your issue, you can think about funding opportunities, and that can be grant dollars, open BAAs, it can be contracts, direct contracts with government, it can be pilot projects. So there's a lot of different ways to shape federal funding at the agency level for your work. And it's not just about money, right? It's about shaping priorities, regulations, and policies that then all have a trickle down into your area. Regulatory decisions, rulemaking, that looks different depending on what agency you're working with, but I think is relevant across a whole host of different priorities. Government data, I think, is something that many people don't think about, just how much data our government has in all sorts of areas. I thought it was really interesting working on the Cancer Moonshot to see just how much of our data work in health was done through partnership with DoD and with VA, just because they have so much health data for our service members and for our veterans. So we can really use data that the government has to, whether you're sharing, able to use that data for your research, whether you're sharing your data with them and pooling data, there's a lot of opportunities there. So you want to be a resource, I think, in whether it's Congress, whether it's the White House or an agency, you want to be the trusted resource for your particular area. And you want to be someone that they go to when they need outside expertise. And then, of course, participating in events, engaging in meetings. So FaceTime, even if that's Zoom FaceTime, with the relevant policymakers at the agency that you're working with. So shaping the process. So no matter who you're working with in government, relationship building and maintenance, and education and awareness is really, really important. And so what vehicles do we use to build and maintain those relationships and make that awareness spread? So advocacy campaigns, whether that's meetings to educate about your issue, whether it's email campaigns, you really want to be educating about the importance of your issue and the effect that your issue has on a member's district and constituents, or state, of course. Congressional briefings. We do a lot of congressional briefings with our clients, especially now. Post-COVID, congressional briefings can happen over Zoom. It really, you don't have to have all your experts in one place. People can be wherever they are and have the opportunity to brief congressional staff and, again, build some education and awareness about your issue. Meetings and tours, whether in DC or in the district, you want to be in front of the correct policy staffer as well as your member of Congress, and thinking about how you can engage those you work with, whether that's your leadership, whether that's volunteers, whether that's people that you serve in your group. Really having that FaceTime with those people is very, very helpful. Congressional caucuses, there are many. There is even a bagel caucus. So there's a strong likelihood that there is a caucus for your issue. And that is a group of members of Congress who already care about what it is that you're working on. And if there's not a caucus, you can build a caucus. That's something I've been working on with my epilepsies group. We now have a House and a Senate caucus for the epilepsies, so something that had never existed before. So congressional caucuses and engaging with them can be very important. Grassroots mobilization, so engaging, again, with constituents for those members, whether it's sending letters, emails, engaging with events. Social media and press is important. Chris talked about legislation and how we can use resolutions and bills to promote an issue and to change policy. Testimony for hearings. Hearings happen all throughout the congressional calendar. And is a way to have your issue out there. Even if you're not testifying in person, you can submit written testimony, is another effective way. Floor speeches, getting a member of Congress to speak about your issue on the floor, even if there's not a policy change as a result, that in itself can be a huge victory. And then with agencies, we talked about meeting with the folks at your particular agency that have jurisdiction or policy oversight over your issue, comments. If you're working with the FDA, if you're working with CMS, everything before a rule change, there's a public comment period. So putting in your perspective and your comments can be helpful. Grant requests for information, RFPs, pilot projects. We'll talk with one of our experts in a little while about the influence of a pilot project and how we can use them to affect change is another really great tool. So I'm going to go to the next portion of our webinar, which I think is hopefully what will be the most informative for everyone. So we're going to have a conversation with some advocacy experts. I will introduce them in a moment, but both Jessica and Arturo, I think why this will be such a great conversation. They are two nonprofit leaders who have really dug into advocacy over the past several years. We've watched them, go from newbies to now just they know it like the back of their hand, and they've really seen some growth within their policy portfolio, within their organization as a direct result of their advocacy. So I'll let everybody else put on their videos, but I'm really pleased to introduce Dr. Jessica Foley. She's the Chief Scientific Officer and Managing Director for Government Affairs at the Focus Ultrasound Foundation. Welcome, Jessica. And Arturo Garcia Costas, who is the Senior Program Officer for Local, National, and International Environment at the New York Community Trust. So welcome to both of you. We are so happy to have the pleasure of your company today. And we're just going to have a conversation. So I would invite anybody with questions. We're going to do Q&A at the end. Please put them in the box. And I'm going to turn it over to Chris to ask our first question.
Thanks, Katie.
I need to take this down. Sorry. Here we go.
Yeah, I think, Arturo, I'll put the first question to you, and I think this question will help set the stage for the rest of our discussion. So, as a nonprofit expert, can you talk about what role advocacy plays in the nonprofit world?
Sure, Chris. First of all, let me just quickly add a little bit of introduction. For those who are not aware, the New York Community Trust is one of the oldest and largest community foundations in the United States. I handle all things energy and environmental for the Trust, which actually includes, even though community foundations are quintessential place-based funders, I manage a national and international environment program for the Trust, which is highly unusual, and it allows us, frankly, to have a perspective on advocacy efforts from the international to the federal, to the regional, to the statewide, and to the local. And at all of those levels, quite frankly, advocacy is kind of the bread and butter of our grant making. Now, I should say that as a funder, community foundations are also a little bit unusual because we're public charities. So we can, unlike private foundations, support lobbying as well as kind of more traditional advocacy, which doesn't necessarily involve lobbying elected officials. However, the Trust, because of that ability, we look at advocacy in the full range of advocacy. And we will identify situations in which lobbying really makes sense, and we'll put some money into that. For example, we supported a $4.2 billion a bond act that the voters passed here in New York State in 2022. So one of the things that I will say about advocacy is that system change is kind of our North Star at the Trust, and bureaucratic, regulatory, and legal systems are notoriously resistant to change. There are powerful forces in play, such as legislative gridlock, complex budgeting processes, and organizational culture that protect business as usual approaches and resist disruptive innovation. And while it's true that right time, right place advocacy efforts do happen and are successful, most of the time systems change advocacy takes patient dedicated effort. And that essentially we have been, for things like congestion pricing, which the advocacy continues. It's a scheme where you put people who drive into the central business district of New York get a charge, have to pay a charge in order to pay for mass transit improvements and everything else. That advocacy effort, the trust has been involved with since 2008. So those are examples of like the kind of patient dedicated advocacy that is often necessary. And the last one that I will say before I hand it back to you, Chris, last thing I will remark on is that we've had really the pleasure of working with G2G on an advocacy effort focused on lead, on preventing exposure to lead for children and basically families across the United States. And way too often people think, oh, lead issues, lead poisoning is no longer a concern. And that's just not the case. And G2G has been enormously helpful in lifting up the issue to key decision makers in Washington, D.C., in terms of federal agencies and in terms of Congress, to say this is not a done deal. This is not a solved problem. And we need to make some changes to the current systems that are clearly not working.
And just to add to that, Arturo mentioned that advocacy is not a short-term deal. It takes a while to effectively make change. A lot of staffers that serve on Capitol Hill a lot of people are surprised when they meet with them for the first time because they happen to be early 20s to maybe late 20s, 30 years old, and they're figuring out what they want to do long-term for their career. There's a lot of turnover. So there really does take this almost constant education of the players in DC that are advocating for these issues and making important decision and policy recommendations to their bosses. So I would just throw that out there. You can't just kind of go to Capitol Hill for 2 days once a year and expect that there's going to be some sort of groundswell of change. And with that, I'll pass it to Katie for the next question.
Well, I want to give Jessica a chance. Jessica, I'd love for you to introduce yourself and just some real quick introduction on the advocacy work that you've been doing over the past few years. And then I have a relationship building question for you.
All right. Well, it's wonderful to be here. Thank you for having me. I'm Jessica Foley. I'm with the Focused Ultrasound Foundation. And we are a medical research foundation. So we are actually focused, no pun intended, on advancing the field of focused ultrasound, which is a wide-ranging therapeutic technology, medical technology that can treat over 180 different clinical applications. So people are familiar with ultrasound for diagnosis, but this is now using ultrasound as a non-invasive therapeutic technology. And it can treat things like Parkinson's disease, essential tremor, various cancers, uterine fibroids. There's so many different applications for it. And so what we've been doing on the advocacy front has really started from just awareness building. So this is a technology, again, that most people aren't familiar with. The field of the focused ultrasound has been evolving rapidly over the last several years, where now there are 9 FDA approved applications, but there's still so much challenge at getting these treatments to patients to make them widely accessible. And a lot of those challenges really fall within the realm of policy and regulatory reimbursement, be it CMS, other types of insurance coverage. And that's where we've seen that we really need to evolve what we do as an organization to extend into the advocacy space. And so where we have historically been, funding medical research, funding clinical trials, we're still doing all of that. But we think it's important to also, try to educate legislators, educate those in the agencies, in the administration about the real potential of focused ultrasound and then, have identified where our barriers are and see how we can work with them to really break down those barriers so more patients have access to this technology.
And Jessica, you and I have been working together for multiple years now. So I feel like I've witnessed your advocacy work grow from some targeted appropriations work to now, we're working on an entire piece of legislation based around focused ultrasound. So how have you built relationships that have really lasted and allowed you to progress your advocacy work in that way?
Yeah, well, I think what Chris mentioned is key, just like the kind of constant drumbeat of letting people know what's going on with focused ultrasound, how does it tie in with them. So we've really started with the goal of, again, just raising awareness of what focused ultrasound is, educating people about this technology that they're unfamiliar with. So doing that through meeting directly with various legislators or their offices in person or Zoom. And then we've had with G2G, we've had a couple of really great virtual congressional briefings that have been really important for educating staffers, educating legislators. We were fortunate enough to have Senator Mark Warner give opening remarks to both of those virtual briefings. And I think that we've been able to use those kind of like evergreen type things as well. We can send them out whenever we want to, when we're making introductions to new offices as well. And then I think one of the big things we try to do is always try to make it local for who it is that we're talking to. So if we're talking to legislators or their staff in California, we want to talk about what's going on in California, or a specific district in California, what's going on there, what focused ultrasound research is happening there, what diseases are being treated there. Again, the constant contact. If there's media stories that come out about new clinical trials at a university in their district, we'll pass those along. And this is where G2G has been instrumental at, again, keeping these relationships going. We sometimes can bring constituents directly into those meetings, whether it's patients or providers of the treatment, or people doing research in the field. And so that's, again, another way of making it local. And then, I mentioned that there's over 180 different clinical applications for focused ultrasound. So chances are there's a specific disease that's of importance to the legislators and staff that we're talking to. So maybe they're co-chairs of a disease-specific caucus, for example. We can make that tie-in. Or perhaps the legislator has been open about a cancer diagnosis for themselves or their family. We can share how focused ultrasound is being used or has the potential to treat that specific disease, and help to personalize what our issues are, talking about the benefits of focused ultrasound. Maybe it's less invasive, a quicker recovery time than the standard treatments. And we've actually had experience where the legislator would say, oh, wow, if I had had that treatment, if I had only had that treatment, how much better would my experience have been versus what I had to go through? So that really personalizes it, and that helps us to build champions that are passionate about bringing this technology to more patients. Similarly, if folks are interested in veterans or our military, we've been able to tie in the focused ultrasound treatments that could really impact veterans, and how it's so important to get the most innovative treatments to those who've given so much to our country. So I think we do all different things to try to really personalize it for who we're talking to.
Fantastic. One question that we often get from folks who don't regularly engage in federal advocacy is, how important are coalitions and building coalitions to successful advocacy? In other words, is there strength in numbers when you're engaging in advocacy efforts? Arturo, do you want to maybe share your perspective on that one?
Sure. Over the course of my career, I've actually been in the advocacy community, in the advocacy world. I've also worked for city government, New York City, for state government, for the federal government, EPA, and for congressional office. So I've actually been the focus of advocacy efforts at all of those stages. And I can tell you, it's so much more powerful when a coalition comes in, a group of folks comes in and speaks with one voice, or puts their weight behind an agenda that they have come together and agreed upon, then kind of an insider approach. That does sometimes work, mind you, but generally my experience has been that the coalition approach is much more impactful. And it's kind of funny because when I think about advocacy campaigns, as I thought about preparing for this webinar, as I thought about advocacy campaigns, particularly coalition-based ones, they sometimes function like a Rube Goldberg machine, right? You know, those machines where you have all these unique, crazy parts that like fit together and achieve a particular outcome, and sometimes an unexpected outcome. I actually think that the coalitions, the coolest, most powerful coalitions I have engaged with are like that. You've got children's health advocates, and you've got nurses, and you've got labor unions, and what have you. You've got a whole interesting mix of partners that have come together and say, like, this is the right systemic change that needs to happen and at this moment.
Thank you, Arturo. Jessica, I wanted to ask you, I think we've heard from both of you about some great successes and things that have worked well. Have there been challenges that you've encountered while engaging in your federal advocacy work? And what did you do to address those challenges?
Yeah, I mean, definitely, I think we faced some challenges. I think on some level, you set out and especially, I think with the type of advocacy that we're doing, there's a lot of different directions that we could go down. And so sometimes our advocacy strategy doesn't really resonate. And so I feel like a couple years ago, we were doing a lot of advocacy around the limited availability of focused ultrasound treatment for uterine fibroids. And that was mostly due to a lack of insurance coverage. But the ask of the legislators wasn't that clear cut because this wasn't a Medicare patient population. So the lack of insurance coverage was more in the private insurance. And so that was hard to really get a clear cut like what can the legislators really do for us. But then we realized that if we kind of broadened what we were focusing on and talked really about the lack of coverage for veterans and service members, who are in fact covered, by government healthcare, and brought in other types of FDA approved applications as well, things like Parkinson's disease and essential tremor and prostate cancer, that we had a better kind of pathway or a clearer solution perhaps. And so that led us to some appropriations efforts around getting more funding, initially funding to the VA to kind of be allow or get more patients access to focused ultrasound. And then we had, another slight challenge where, we didn't get the funding that we had requested, but we did get good report language. And so that was the first time we ever had report language specific to focused ultrasound. So I think that leads to what we talked about before, that there's these sort of building blocks where maybe you start with a big idea of what you want, but you don't get there right away. So focusing on some of the small wins and then how those can eventually build to larger things down the road, I think is also really critical here.
Yeah, it can sometimes be, the 2 steps forward, 1 step back kind of situation for sure.
I just want to ask, one more question here. In my time, on the Hill, I don't know how many thousands of meetings I conducted with constituents and other advocacy groups, but in my experience, at least, the meetings that I remember and that stand out are meetings in which folks came in, really took the time to share their personal stories with our office. And so my question, and Jessica and Arturo, either of you feel free to add to that discussion. But from your perspective, how important is it to share those personal stories when engaging in federal advocacy? And how have you sort of had that be part of your overall approach to federal advocacy engagement?
Well, I'm happy to jump in. So, I think that's incredible. I mean, that's been critical to what we've been trying to do. We actually have a congressional fly-in every year since 2019, and we bring in patients and physicians and focused ultrasound companies, those who have direct experience with these treatments, and these individuals then can engage with their members of Congress and staffers and share their own focused ultrasound story, and then on top of that, advocate for whatever it is that we're trying to advocate for at the time in our legislative agenda. But witnessing particularly the patient stories and the impact that these have on the members of Congress, on their staff. We've had some of the same patients come year in and year over year, and staffers have remembered, said, I've only remembered there's only 2 stories that I kind of like keep written down in my office, because I always look back to them to think about what we're doing and how it matters. And yours is one of them, to one of our patients. And so to hear how patients can talk about the truly transformative impact of focused ultrasound in their lives and their families' lives, that's really powerful. And it's powerful for me, who's someone who knows a lot and already is passionate about this technology, but then that really makes it personal for the people that we're talking to. And I think, as Chris said, then that really sticks with them. So I think wherever we can, we try to allow those personal stories to be told, whether it's through the best is obviously the in-person meetings, but other types of meetings or briefings as well. We try to include that patient story aspect specifically.
Yeah, let me build on that a little bit, Chris. First of all, let me preface this by saying I completely believe in evidence-based, data-driven policymaking. That is super, super important and should be like the threshold for how federal agencies arrive at policy and et cetera. However, we also can't discount the power of humanizing that data and humanizing scientific research and that kind of evidence, because as Jessica just said, that is what sticks in our minds and in our hearts, right? And I think truly effective advocacy campaigns find the right balance between those things. And I'll give you like 2 quick examples. One is, honestly, we are not where we need to be in terms of the fight against a human-driven climate change. And part of it is that we have been depending too much on the climate science. It's like the data is obvious. It's clear this is happening. And it really, the most progress we've made in recent years is focusing on the human dimension of the impacts of basically catastrophic climate change and a climate system that's out of control. And more personally, one of the reasons that I have been an anti-lead warrior since graduating from law school is that I was personally affected by that. I was diagnosed with learning disabilities when I entered college because I was not able to complete my blue books because my handwriting was too slow. So I went through a whole battery of tests. And the diagnosis was that I had probably been exposed to lead when I was younger, and that had affected the part of the brain called Broca's brain. And so since that time, I've really kind of focused on lead, and I have seen when you bring out the personal testimonies of families that have been affected by lead exposure of various kinds, most often in the home, but you also have basically the lead crisis that happened in Flint and Jackson, Mississippi, and other places, and Newark. when you bring in the personal impacts, the family impacts that situation is going to have for them, for their entire, sometimes the entire lives of their children, I have seen how that changes the perspective of the decision maker sitting in the room. So I think the most effective advocacy campaigns find that right balance between the data and the personal impact, the human story.
I love that, Arturo. It is a very delicate balance of the data and the humanization, and I've watched you do that very, very well in the meetings and the communications that you do. All right, I just want to kind of close us out before we do a quick Q&A. That advocacy works. You see on the left here, Jessica and her focused ultrasound group with Congresswoman Debbie Wasserman Schultz. We are working with that office on a bill to provide more funding for focused ultrasound therapy. And then on the right here, you can see Arturo during a congressional briefing that we did on lead and other home hazards. And just a couple of key takeaways before a question, and then Liz Powell will close us out. But knowing your needs, what are you trying to achieve? Why are you doing this? And that helps you understand which agencies you're going to target, which branches. So accurate targeting to your goals is really important. Understanding how the system works and where you are, you know, in the cycle for budget and legislation. You know, we talked about appropriations, and you've got to have really your ducks in a row at the start of a new calendar year if you're going to influence that process, because so much happens within just a couple of weeks, you know, in the late winter and early spring of every year. Strategic targeted messaging, whether that's through white papers, policy proposals, social media, that's really digestible and targeted at your audience. Relationship building, we talked about them. It's not just building them, it's nourishing them, maintaining them. We talked about knowing the process and the timing, bringing your public officials, whether that's a member of Congress, their staff, someone from an agency, to where you are to see the impact. You know, I think about Jessica, and we've brought members of Congress to see focused ultrasound in action. I'm thinking of Dick Durbin and how excited he got after he got to see this. Or Arturo, I'm thinking about bringing Sherrod Brown to a neighborhood in Cleveland to see a house in disrepair, to meet a family that was impacted, and to decide to make change in that area. Engaging with the community, grassroots is really important. Staying persistent, never giving up at the bottom. We have setbacks. We don't always succeed the first time, but we keep going. Okay, I realize we are right at the end here. So I think I'm actually just going to send it over to Liz to let her close. What I would ask, though, is on this slide, you can see emails for all of us. If you have questions for Jessica or Arturo, please email me or Liz or Chris, and we will get you those answers. So Liz.
Thank you all for dialing in. Hopefully that was helpful information. Katie, it might be good for you to put some email addresses in the box there, the chat box, so people just cut and paste. So thank you again for joining our webinar on how to do advocacy effectively, to access funding, to shape policies and regulations. I think you got some great tips from our experts, Arturo and Jessica. They know how it works, and they've seen how it works. And what's great is that they shared hurdles, they shared barriers and how they got around them, and they kept going. I think that persistence is super, super important. So we would love to answer your questions, be a resource for you. So let us know. We will share the recording and the slides so you are equipped to go be awesome advocates. Thank you again for dialing in, and have a great afternoon. Thank you.